I'm going to talk about fibromyalgia and the prevalence of DAO deficiency in patients suffering from this condition. Fibromyalgia is a chronic condition that causes pain all over the body, fatigue, and other symptoms. People with fibromyalgia may be more sensitive to pain than people who don't have it. This is called abnormal pain perception processing. There are several symptoms that the main one is widespread pain, and other symptoms include increased sensitivity to pain, muscle stiffness, difficulty getting to sleep or staying asleep, which can make patients feel very tired with fatigue and tiredness. Also problems with mental process, such as difficulty concentration or remembering things, feeling of frustration, worry, or low mood. Also headaches, including migraines, we have talked about that, and irritable bowel syndrome, a digestive condition that causes stomach pain and bloating, as we talk all day about that. The symptom of fibromyalgia is very important to say that as changeable. They are sometimes suddenly improve or get worse. So for patients are very difficult to manage. Who can be affected for this condition? Anyone can develop fibromyalgia, but it's more common in women than in men. The condition typically develops between the age of 25 to 55, but people of any age can get it, including children or other people. There's no clear exactly how many people are affected of fibromyalgia, although research has suggested it could be a relatively common condition. Some estimates suggest nearly 1 to 20 people may be affected by fibromyalgia to some degree. That's why 1 to 5% of the population. What are the risk factors of fibromyalgia? There are some risk factors known. They include age. Fibromyalgia can affect more people of all ages, including children. However, most people are diagnosed during middle age. Also, lupus and rheumatic arthritis are also risk factors. But there are other factors that weakly associate with the onset of fibromyalgia, but more research is needed to see if they are real. These possibly risk factors are sex. Women are twice as likely to have fibromyalgia as men, stressful or traumatic events such as car accidents or post-traumatic stress disorder. Also, repetitive injury from repetitive stress, illness like a viral infection, or family history or obesity. Family history tells us some things about fibromyalgia has a genetic background. How can we diagnose it? It's very difficult to diagnose fibromyalgia. It's very hard. Sometimes the patient need to go several visits or they need to visit several doctors to get a diagnosis. One problem is that there isn't a specific test for it. And the main symptoms, that is pain or fatigue, are common in many other conditions. Doctors normally can use several tools to make a diagnosis. For instance, medical history, including asking detailed questions about symptoms such as widespread pain lasting more than 3 months ago. A physical exam, including fatigue, waking unrefreshed, or cognitive memory and thought problems. Also, the number of areas throughout the body is with pain and had in the past week. Sometimes doctors can make X-rays tests or blood tests to rule out other conditions. There is a questionnaire that is very useful for doctors. It's called the Fibromyalgia Impact Questionnaire. It was developed and published in 1991 to measure the impact of this condition to the daily living abilities and general health status of the patient. The objective is to take into account not only the pain, but also symptoms such as restless fatigue, muscular stiffness, depression, and their impact on perceived quality of life in the previous week. There are 10 self-administered questionnaires that measure both physically and psychologically symptoms and their interference in daily living tasks and the perceiving quality of life for patients. I show you here one example of the questionnaire that patients need to create. For doctors, it's a good point to work because they can know if the patient is going to get well or not with any treatment. But that's the point. How can we treat this patient? Not all doctors can, they are familiar with fibromyalgia and its treatment. Mostly this type of patient should be treated by a rheumatologist with a combination of treatment, which may include drugs, lifestyle changes, talk therapy, and complementary therapies. Talking about drugs, they should recommend over-the-counter pain reliefs, or also precision medicine that are specifically approved for treat fibromyalgia, or prescription pain medicines, or certain antidepressants, sometimes which may help with pain or sleep problems. Also, for lifestyle changes, the doctors recommend getting enough sleep, getting regular physical activity. It is recommended if the patient has not already been active, start slowly and gradually increase how much activity can get. Learning how to manage stress, eating a healthy diet, and also talk therapy can help them, such as cognitive behavioral therapy. It can help patients learn strategies to deal with pain, stress, and negative thoughts. Patients with fibromyalgia have normally complications. This condition causes pain, disability, and lower quality of life, but that affects all over the life of the patient because they have with more frequency, more hospitalization. They are twice likely to be hospitalized as someone without fibromyalgia. They normally have lower quality of life. They have higher rates of major depression. Adults with fibromyalgia are more than 3 times more likely to have major depression than adults without fibromyalgia. Screening and treatment for depression is extremely important in this point. Also, the patients have higher rates of other rheumatic conditions. Fibromyalgia often occurs with other type of arthritis such as osteoarthritis, rheumatoid arthritis, systemic lupus, or ankylosing spondylitis. What is the causes of this condition? The exact cause is unknown, I'm sorry, but we don't know about that. It's thought to relate the abnormal levels of certain chemical in the brain and changes in the way the central nervous system, the brain, the spinal cord, and nerves process pain message carried out around the body. Evidence support a central sensitization and a central dysregulation at a spinal and supraspinal levels of fibromyalgia patients compared to controls. Also, these patients show an exaggerated pain response after sensory stimulation and an extended cutaneous silent pain. So this show us this can hypothesize a decreased serotonergic or noradrenergic activities. The main point I would like to show you is that fibromyalgia is not from an autoimmune inflammation, joint, or muscle disorder. Let's review a little point about main genetic causes. There are several evidence suggesting a genetic predisposition of fibromyalgia. The previous session, Professor Eva Ruiz tell us some of them. Studies in twins show that genetic factor contributes almost 50% to the risk of developing fibromyalgia and chronic pain. Also, familial aggregation of fibromyalgia has also been demonstrated. There are some studies of genetic association studies or linkage studies having carried out, and the influence of environmental factor on the development of fibromyalgia has been evaluated. All these processes are now in investigation. A new line research is epigenetics. It's also very promising, and I hope we will discuss next year about the epigenetic of DAO deficiency or fibromyalgia. Up to now, the genes that have been proposed as candidates associated with the development of fibromyalgia are those related: serotoninergic metabolism, dopaminergic pathway, catecholaaminergic pathway, ion channels, and neuroplastic pathway. In that table, you can see some SNPs and genes potentially related to pathogenesis of fibromyalgia with the clinical association of each of them. Let's talk about DAO deficiency. We have been talking all day in this Congress about the adverse effect of DAO deficiency. They are nasal congestion, asthma, hypotension, hypertension, arrhythmias, migraine, headaches, fibromyalgia, also one of them, and muscle pain. In conclusion, some causes of DAO deficiency can be related to the symptoms of fibromyalgia patients. Also, it's recently been published that diet modification in patients with this condition by specific histamine release test improves certain clinical parameters related to the symptoms of digestive sphere. For all of that, we propose that DAO deficiency could be a biomarker for fibromyalgia patients. That's why we make this research. I'm going to present an epidemiologic study conducted to observe the association between genetic DAO deficiency in Spanish female fibromyalgia population. We have 98 Spanish women with fibromyalgia between 33 and 60 years old. Age and medical diagnosis were considered in the inclusion criteria, while multiple chemical sensitivity, also following a diet low in histamine or being on DAO treatment. And we consider as exclusion criteria if patients have some chronic diseases like diabetes, cancer, AIDS, or Alzheimer's. And we analyzed 4 variants in AOC1 gene, where in its samples, the variants have been presented this morning in this Congress. So there is some session that we are going to talk about them. You have it in the slide. We performed this analysis from an oral mucosa sample. This type of women are very special, so we would like to facilitate all the most part of the study. And it was oral mucosa sample with cotton swab, and we isolated DNA in automatic isolation process in a Kia Symphony machine. And we performed the genotyping with a single nucleotide prime station in a capillary electrophoresis. The result I'm going to show you, the prevalence of genetic DAO deficiency in our sample of 98 Spanish women is 24.5%. Have one of the 4 variants that we are analyzed. This includes all patients with at least one heterozygous or homozygous genotype with a minor allele in any of the variants. I think it's a very impressive result. All genotypes have a frequency like to the one expected in Caucasian population. But one of them, the second one, you can see in the slide that there is no, the genotype TT homozygous, we have not been detected. This is already expected condition because the Caucasian population have the same frequency. But this is the reason of you cannot see this genotype and in this slide, and the frequency of the homozygous genotype exceeds the 80% in this measure. Finally, 14 genotypes combination were observed among the variants, including the study of our sample of women. The combination of genotypes with the allele associated to normal activity of DAO enzyme is the predominant, followed by the one with heterozygous, and the rest of combination were found below than 10% in our study. I would like to introduce the term of genetic risk score. We are proposing different sessions in this Congress the creation of this genetic risk score for DAO deficiency. The association of the presence of this combination of variants with the symptoms of the patient will be the subject of future research, and we will present this next year. We found, as a conclusion, we found a higher prevalence of genetic DAO deficiency in our Spanish population of fibromyalgia, with the presence of one or more alleles associated to DAO deficiency. Therefore, we conclude the variants of AOC1 gene can be a candidate of genetics DAO deficiency and potential disruptive biomarker for future treatments in fibromyalgia patients. This work is currently in press, and it have been made possible for the collaboration of Finusa team headed by Ismael San Mauro and our team in VIVOLABS. Thank you very much.